so as a patient, how do you make sure that you have access to this level of individualized care? Because it sounds like you really need, to have a clinician who is extremely familiar with navigating these types of databases and tuning this, to this degree of personalized medicine. How does a patient guarantee that this happens? Or what can they do to make sure that, they're seeing a clinician that has these resources?
The analogy that I like to make when you're finding a clinician is when you're looking for an answer, whether it's an answer about health optimization, you're trying to have optimal athletic or cognitive performance, or just a very long health span, that is a relatively difficult question. Or if you think you may have a zebra, which is what we refer to as like rare diagnoses, that's also a difficult question. If you have a difficult question and you're in a class, you don't just ask the teacher. So you don't just ask the society that makes the guidelines or like look online for that. You don't just ask who you think the smartest kid he or she is in class. You would ask everyone and look everywhere for the answers, and you would look and see what other people have found that have had similar questions. And that's probably why a lot of people listen to podcasts like these.
Right.
And then you would shop around. So just like, if you had let's say you have a race car and you're trying to have perfect performance or find something that you think is wrong with it, you would likely go to several different mechanics and see what their opinion is, and then choose them over a long period of time for a period of many years, and then work with them in tandem over years, doing a process that we call shared decision making, which is we know your goals, whatever it is, and then we are willing to continue to dig. There is always more digging to be done, and I never like to say this is due to aging, and I also never like to say we've done everything that we're able to do, because there's always more digging.
Yeah, and finding a clinician that is going to take their time and dig into whatever your particular question is typically not going to be in the traditional medical model inside of insurance and organizational constraints. You're typically going to find that outside of that model. Now, for example, all the time we'll have patients ask us questions like, I read about this supplement, or I saw this, this scientist that said that this will lower my blood pressure, or lower my cholesterol. And it's important to go and look at those studies with a nuanced eye, because is that, extra serving of blueberries lowers blood pressure? Is that by 2 millimeters of mercury, or is that by 20 millimeters of mercury? Because you can have, it's something we say all the time, a statistically significant difference, but it's not going to make a clinically significant difference. Same thing with cholesterol lowering supplements, or supplements that can move the HDL and LDL numbers around. Maybe it's a 5 or 10 point difference, but is that going to translate to treating somebody with familial hypercholesterolemia? Can I just take citrus bergamot instead of a PCSK9 inhibitor? No.
Yeah, and I think this is one of the reasons why I think I saw a 5,000% increase in searches for functional medicine and integrative medicine, because people intuitively know that if they have a problem that is not one of the algorithmically solved problems within our current system, they seek healthcare outside. So there's a 5,000% increase in searching. But when you're looking at the intersection of conventional medicine and functional medicine, there is not a good standardized, there's like no Cochrane review, there's no up-to-date specifically for functional medicine.
Right. Also going back to the last point, it's something that we talked about yesterday. There's a ton of journals, there are a ton of publications, and you don't need to have a medical background, you don't need to have an MD or a PhD or a PharmD to sit down and gain meaningful insight from medical literature. But there is a caveat, which is, how do you know which studies are good? How do you know which journals are reputable? And to a patient, what should they be looking for? And we could even take it one step back even further. How do they even access medical literature of the same quality that a healthcare provider could access?
That's a great question, and a lot of times there are journals that, healthcare providers, unless your organization is subscribed to that journal or has some sort of partnership, those articles are typically going to be behind a paywall. So personally, I've reached out to some, PIs or whoever the correspondent is for the article, and they're more than happy to send over a PDF most of the time to get you access to that information. But for your, layperson, should they be sending out emails to the authors? Should they be going to a public library perhaps that has some of these sorts of memberships? What would you say for the layperson who wants to get access to that research, and then talk about those things with a qualified provider? How would they actually get to the articles in the first place?
I think a really good place to start is Google Scholar or PubMed, where you can filter articles by open access. So open access or Creative Commons published articles, are free to read. They're not behind a paywall, and generally, they're easy for somebody to search, find, and download the PDF. And there are institutions like you mentioned where, if you have an institutional login, you probably have, access to a significant number of journals. But to the layperson, that's not super helpful. I think that ResearchGate is also a really useful tool where, it's free. It's a free platform. It's basically scientific and clinical Facebook. But most of the publications there, whether or not they're open access, you at least can make a specific request for a PDF of a paywalled article, for example. That being said, does it make a lot of sense for a provider or a patient to spend a tremendous amount of time reading all of the literature out there? Definitely not. So I guess I have my thoughts on sort of how to approach a literature review. What do you guys do, or how do you make sure that you're not wasting your time?
This is one of the things that you learn to adapt to in medical school as well. They have journal clubs, and you look at the article very critically and constructively at the same time. And you're looking at all parts of the article and what its limitations and benefits are. And you're looking at what the goal of the article is as well. So there's a couple different ways to approach it. If you're doing a peer review, then you write out that info and you try to be helpful. And then you take whatever knowledge you can away. And then if there's something in the conclusions, before you even read the conclusions, that you did not think was portrayed as well as it could be, then just keep that with a grain of salt. That's why we have the peer review process.
I think that starting with review articles is probably a really beneficial, or a beneficial starting point, specifically for patients. You can definitely extract the most information in the least amount of time with a reputable review article. And it's easy to get lost in one of the 300 to 400 references cited in a review. So I always think that, at least during my PhD, if I was starting a new project or reading about a particular disease state, I would always start with multiple reviews before I would get into the weeds of the data.
Definitely, you go down that tier of evidence. So if you're looking for a specific question and not necessarily just evaluating the article, you want to start with systematic reviews or meta-analyses. And that's why some journals are more patient-friendly. For example, Cochrane Review or New England Journal, they have their pros and cons, of course, but they are quite patient-friendly when you compare it to most journals.
Right, agreed.
Yeah. And it's interesting, sometimes we'll have the case where a patient, they have an article, because basically if you're looking for something in the literature, you can find that either in vitro or preclinical. We joke, you go to iamright.com and here's your answer. But the patients will say, well, what do you think about this article? And you look at the sample size that was involved in the study. Is it 10 people or is it 10,000 people? You look at the differences in the control group versus the intervention group if it is a interventional trial. And there's just many things that you pick apart there. Sometimes you'll look at the subgroup analyses, which are showing a statistically significant difference, but it's not adequately powered. So subgroup analyses in general are more for hypothesis generating than applying to a clinical population. A great example of this is some of the aspirin trials way back when that was being investigated for treatment of acute MI, and they actually had a pretty difficult time showing benefit. But eventually one of these trials showed a strong favorable effect on acute MI and aspirin, but the initial submission actually got rejected. I believe this was the New England Journal of Medicine. I may be mistaken there, but it was a prestigious journal, and they said, hey, we want you to do a subgroup analysis. So the investigators of that study did their subgroup analyses by astrological sign, and they actually found 2 astrological signs that had no benefit from aspirin therapy. Now, that's certainly not evidence-based medicine, and it just shows the more ways you slice and dice the data, the more likely you are to find something just by coincidence. It's hard to imagine a world where they go into an ER. What's your date of birth? Oh, nothing we can do for you.
Nope.
Sorry.